Hey everyone, welcome to this episode. You're here today with Shaun, Brewster and Bodine, Ledden. Bo, today we're going to talk about one of those things that I know I've heard lots of people complain about over the years. They'll come in the same location, let's come back, I've given them advice, they've come back for their second or third or fourth, 500th treatment, whatever it might be, and they're just not doing what I'm telling them to do. Patient compliance. It's one of those bugbears. We often have challenges, right, with patients that just don't want to follow our instructions.
Yeah, it sort of feels like you're banging your head against the wall a little bit, and doing the same thing week after week, and they're not taking that advice on board. And yeah, it can be frustrating, can be a real challenge to overcome.
Absolutely. I think when we were talking about, when I was thinking about this topic for today, I thought about the word compliance, and it actually doesn't really fit very well in my mind. So compliance is the word we often link with someone giving orders, almost like a dictatorship. You will be compliant with my instructions, and it's really not the relationship, is it, with patients? We're not giving orders, and they have to be compliant with it. It's a very different dynamic than that.
Oh, 100%. And, we don't really like to be told what to do. And it shouldn't be like that in a consultation. I mean, yeah, we're the professionals, we can provide people with advice, but it shouldn't be a rigid protocol. This is what you have to do. And if you don't, it's not going to work. It should be that shared decision making. Understanding their preferences and their goals and their beliefs and all of that sort of stuff, and coming up with a strategy together. I think that's what's really important, because if you tell me to do something, I'm going to go, well, he probably doesn't really know what he's talking about. I'm just going to do my own thing.
That's right. Yeah. And often patients will come in with a lifetime of experience with their particular problem, and they've seen other practitioners. It's a good point you make about the shared decision making, because your advice might be 180 degrees different to the advice they received from somebody else who they may have trusted in the past. And they might hold those two things in two hands and go, well, hang on a second, which one of these is right? Possibly neither of them, then therefore I'll do nothing. And they end up, where they started. So I think that the shared decision making is a really good way to frame it up.
Yeah, definitely. Like, we've got to take on board their beliefs and their understanding and actually what they want to do going forward. Because if what we provide them doesn't align with that, then the compliance will be minimal to none. And I've experienced this. I remember as an early practitioner when I first started out. I'd prescribe people with what I thought was the best exercise program, the best rehab protocol, and all of this sort of stuff. But people didn't comply. People weren't doing it, and where I went wrong was because I wasn't understanding what they really wanted to do, how it fit in with their life. Did they have the time to be able to do these exercises? Do they actually enjoy doing those exercises? Um, and failing to sort of check off these points and really having that shared decision making, that's sort of where it all fell apart. And that led to me getting more frustrated and thinking, well, they're just not trying here. But it was probably my fault for not actually understanding deeper layers and the other things that can be associated, and allow them to make the decision about their rehabilitation and their exercise plan and what they want to do going forward.
Yeah, I think that ownership point that you touched on there, like it's your fault. You didn't give them the framework that worked for them. And I think that's the frustrating, that's such an important factor for so many people that are getting fed up with their patients who aren't following their advice, whether it be with an exercise or activity modification or the way that they manage themselves through their rehabilitation, whatever it might be, is if they're not doing the thing that you're asking them to do, then we have to look at it from the perspective of, okay, well, what aren't we doing to validate their choice there? What aren't we doing to help them get to the point where they need to be? And I think there's sort of two things that come to mind for me. One is we need to give them reason enough to believe in us. Um, we need to give them enough. I guess, like, probably the best way to describe it is just reason to believe that that the advice we have holds enough weight. And a lot of that comes through the authority that you get from a specialist or from someone you see as an expert. And if you've been to every practitioner in your town or city, and then eventually someone says, I know the person you need to see, they're brilliant at this, they are absolutely the king or queen of this particular thing. If you go and see them, I guarantee it's the person you want. And then straight away, that person has this authority type figure. Now you'll go there and you'll expect to pay more money. You'll expect to wait longer to get in there. You'll expect all those things that you get with a specialist, which is fine. But when you get there and the person says, do this thing, I'd say most people would be more likely to do that thing because the authority that comes with that. Now, we can't all be a specialist or the expert or the king or queen at something. But I think what we can do is work really hard at building the rapport, building the trust, and building the belief with your patient that what you have to share with them, the advice that you have for them, actually will work. And if they walk away going, oh yeah, he or she said I should go home and I should do this thing 3 times a day, or I should stop doing this, or I should do more of this. Yeah, okay, well, I'll see if I get around to that. Versus I walked away really believing that person knows their stuff. And the way we get to that point, I think, is presenting ourselves with enough certainty in ourselves. Like presenting ourselves as like, I can help you. I have a really strong belief that I know what's wrong, how I can help you here. If you were to do these things, I feel very strongly that you'll get these outcomes. And you have to convey that in a very convincing, honest, and straightforward way without any blurred lines, without any kind of rough edges, so that the patient doesn't have any wiggle room. They have to, absolutely share the decision making on how that's delivered, but they have to feel like, this person knows their stuff, and they have some certainty in that. I think that's really important as well.
Yeah. And even, when we look at it from an education point of view, we've got to really educate our patient about what's going on and why we would like to prescribe them with these movements, exercises, stretches, whatever it may be. So that's where we get that buy-in. We build the trust, we build that rapport with them, but we're really sort of educating them about the process and why it may not have responded in the past. And how we can progressively get you towards your goal. So it's got to be that education. There's got to be some goal setting there. We've got to understand their preferences and set realistic timeframes. Because if someone comes in and they think, I tried the exercises that I was given last time, I don't really know what they were for or why I was given them. I did them for a few weeks. They didn't really work. Setting these realistic timeframes that you're probably looking at a minimum 12 weeks. It could be 6 months. It could be 12 months. These are long-term changes. It's fairly slow. And at the same time, when we go through educating, setting realistic timeframes and understanding all of those other factors, when we look at an overall treatment, their perception, if we do a treatment to someone and their perception is that you're doing something to me to fix me, it's up to you, that change in self-efficacy there. And then it gets to the last 5 minutes and you go, and by the way, let's quickly do these few stretches and few exercises, and you scribble that down on a bit of paper. Well, that doesn't demonstrate a whole lot of importance there. It's sort of, this is a last minute thing that you can do as a bit of an add-on. Whereas if we really take that time going through those exercises, those stretches with them as a part of the treatment, demonstrating that whatever manual therapy you do is essentially there to reduce inhibitions to movement and exercise and decrease their pain. But for these long-term changes, this is where we need you to do these exercises and stretches or whatever it may be, so that they feel confident with them. They know that it's an important part of their treatment, and they're more likely to comply with them at home because we're sort of going through that process. Does that feel comfortable? Do you know what you're supposed to be doing here? Do you feel like it's working? All of this sort of stuff, understanding their perception so that they're more on board with that exercise. And I think that's really important is just demonstrating the value of it within a session and not just a little bit of a throwaway, here's a few exercises and stretches at the end of a session.
Yeah, 100%. I agree with that. And I think that you touched on something I wanted to talk about too, which is like giving the advice the appropriate weight, giving it the appropriate space and time in the treatment session so that it's valid, it's perceived as something that's important and valid. And I like to look at things, I like to think of a treatments plan a little bit like the way I teach, which is I tell the person the thing I'm going to tell them. I tell them the thing and then I tell them what I told them. And so they get this kind of, here's what's going to happen, here's what's happened, and here's what's happened. And I think that's a nice way to frame up a treatment too. You can start at the beginning and say, okay, I've done my assessment. Here's what I think is going on. The best way I can help you with this is I'm going to do some, for example, manual therapy at the start, which is going to reduce your pain. So we're going to do that trick. It's going to reduce the pain. It's going to settle it down. Once that pain settled down, you'll probably feel a little bit like you can move a bit more freely, a bit more comfortably. Then we'll talk about some exercises and things, because I know that if I get you to do exercises now while you have pain, you're not likely to do them. And I wouldn't either, right? So that's fair enough. So get that buy-in with them, get that kind of cohesion. And then you do the treatment, and then you get to the point where it's the advice. You go, okay, now we're going to get to the bit where I can get you to do the things that you need to do, which will carry on the effects of this treatment. Because what I've just done now will give you short-term advice, short-term outcomes. It'll give you pain reduction, which is nice. And unless you want to come and see me every day for the rest of your natural life, which I'm sure you don't, then that's not going to be a long-term solution. So treatment done, settle the pain down, get you moving. Here's the bit that's going to now extend it for you, and the thing that you can take some ownership for, and really the thing that's going to be most important, because it'll be the thing that requires me to exit your life. Like, you don't need me if we can do this bit really well and you can manage this yourself and get back to normal life. And so give them a reason to believe that this is the thing that's important. That might be 75% of your treatment, the advice bit you're talking about. It might just be 15 minutes or 15% of the time is the treatment. And then they realize that, okay, he'd settled down my symptoms. Now this is the important bit. This is the bit that's going to get me to the solution. And so that's what I mean by give it enough weight. Tell them what you're going to do it, tell them what you did and why, and then tell them what you did afterwards, so that it actually gives them a long-term progression, so they can see how this story will play out over time. So give it weight, give it time. And I think that's where we often fall down. You mentioned it the last couple of minutes, scribbling down some exercises and sending them out the door. No one's going to pay attention to that. And they feel like it's a throwaway, gesture at the end. But, if we're talking about active participation in treatment, that should be the crux of it, really. Maybe not in the first session. Maybe there's a bit more hands-on in the first session. But especially as you progress it over time, it should be more and more, okay, now what can we get you doing? What can we get you modifying? How can you manage this without the need for me?
Yeah, definitely. And even identifying their beliefs from the start. What do you think is going to help this? They may have seen several practitioners and they've had some relief for a few days, but, now it's been persistent for 12 months, 2 years, 5 years. Why do you think that it hasn't quite gotten better? Have you done some exercise before, or do you understand the reasoning for that? And they might have said that they have done some exercise, or they haven't, or whatever it may be. But if they have and they feel like it hasn't worked, well, what are the reasons for that? Were they given too many exercises? Did it take too long? Were they too difficult? Did they not have access to the equipment? Did they not understand the reasoning behind it? Was it not progressive? So many different factors, and we've got to sort of drill down on all of those things of why something didn't work. Because at the end of the day, when we look at exercise and home care, all of that sort of stuff, it probably doesn't need to be as specific as we like to think it does. It can just be very general. We even look at the best exercise for low back pain. There's no such thing, just general exercise, just something. So getting someone on board from the start with exercise, just find out something they enjoy doing. Do they have someone that they can exercise with? And if not, that could be you. As far as in the session, that supervised exercise, that is really important. So it's integrating something into their life that they like doing. I think that's super important, and not just, I've got to try to squeeze in 15 minutes for these exercises, which I hate doing. Well, you're probably not going to get much out of it anyway. So, you're better off going and doing something that actually makes sense for them and they enjoy doing.
I think this point about them not being intrinsically motivated, we have to assume that the patient is not intrinsically motivated to help themselves. I think if we start from that point, that like, okay, they don't feel like doing this themselves. They've come to me for some support. I know that their participation, their active participation, is going to be crucial for the long-term solution. But at the very day dot, I need to assume that they are not intrinsically motivated to help themselves. I'm going to start from there. And if we start from that point and think, okay, what can I do to inspire them, to motivate them, to educate them, to take them with me on this journey, as opposed to me dragging them along, which is what I think often ends up being the case. And if we start from that point, I think that frames everything very differently for us, because we have to think, okay, I need to put this patient in front of me, and then I'm going to guide them rather than drag them by the hair down the road. Like, it's a completely different scenario. And that only happens with trust and rapport and belief that you are able to help them. And their participation is crucial. And so starting from that point, I think, makes all the difference.
Yeah, a little tip. I think I've probably said this before in previous podcasts. It's something I like to do to once we've got them on board and we're trying to figure out an exercise program, rather than just randomly saying, "Oh, well, let's do 3 sets of 8 reps 5 times a week." Have a look, ask them, what's your week look like? Where do you have some free time? Is that Monday mornings? Is it Friday evenings? Wherever it is. So I have a little printout of a calendar just that I then can write different things in there. So if it's Monday mornings, Tuesday midday, wherever it may be, do you think that you'd be able to do 15 minutes of exercise that you enjoy doing on Monday morning, that you've got some time free? Great, let's put that in. So we're not telling them when they do it. We're allowing them to make the decision and fit it in with their schedule that works for them. And then, if they don't stick to it, we can have a chat with them. What happened last week? How'd you go with these exercises? Then we've got it's more their decision. They told us when they were available, and they told us how long they wanted to exercise for, and they told us the type of exercise that they wanted to do. So they're more accountable then, but we can just we're a coach. We just have to understand what factors influenced some non-compliance that week, or what could we adjust a little bit here and there to get you on board a bit more the following week. So not having these rigid rules, it really is that we are being a coach, and we've just got to understand that people have lives. There's so many different factors that can be involved, and we've just got to work with that and get their opinion and their choices, because that once it's their choice, then they're more likely to comply.
That's so true. And it reminds me, when I was doing a lot of running coaching, I'd do that same thing with the exercise. Like, I'd sit down we'd sit down across the table and say, okay, tell me what your week looks like. And I'd plan out their sessions, and they'd say, I reckon I can do 5 runs, 3 runs, 4, whatever the number is. And we go, okay, what days work best? Mornings, nights, how much time have you got? And we'd factor it all in. And at the end of the month, we'd come back for a checkup, and I'd say, how'd you go? Which sessions did you hit? Which ones you didn't? And then they'd look at me as if to say, I've let you down. Like, they actually feel bad because they made the decisions. You're absolutely right. They chose those sessions. And then we can explore that and go, okay, well, why didn't you hit that session on a Tuesday afternoon? What was the reason? Oh, something came up. Was it a random thing or something that happens all the time? If it's something that happens all the time or fairly regularly, let's adjust that. Maybe we can combine that with another session. Maybe we put it somewhere else. That makes them much more accountable, because you're right, they made those decisions. So let's flip it now. Let's imagine we've gone to consultation number 2 or number 3. We've given them advice. They've gone away going, yeah, I'm going to do this. They come back, and you sit down across the desk from them. You say, okay, how have you been? How did you go with those exercises, those activity modifications, those things that I gave you to do? How did you go? Right. And they turn around and say, oh, I didn't get them done. What's your response to that, Bo?
Yeah, I'd firstly say, what was the reasoning? Can you tell me a bit more about what went wrong there? And it could be just that they didn't have time, or something that I've come across before is that they didn't actually like that exercise. They did it, or it caused some pain. Okay, that's no worries at all. It's not anyone's fault. Let's just look to modify it. And then it goes again back to that drawing board of, right, well, what do you want to do? How do we make this fit in with your life and your schedule? And let's go through some exercises that are a little bit more comfortable, or a little bit easier for you to do. And then we can work with that. Would that sound like a good idea to you? So yeah, I'd sort of go back and reset those goals from the start, because there's probably something that we missed in that first consultation about compliance and even just general motivation towards their exercise and reasoning.
Yeah, absolutely. And I think there's so often with a patient will come in and say, "Oh no, I didn't get to it," and our response, and I've seen this, will be, "Oh, that's okay. All right, well, let's look at next week then. What can we do?" And you just kind of throw that away like it didn't matter. So therefore, the importance of the advice you gave them is also zero, because you didn't care about the fact that they didn't do it. All you're worried about is today and going forward. And it's good to have a forward outlook, but why didn't we do those things? Why haven't we progressed? And you're absolutely right. Let's go back through the reasons why the things you told me you could do and wanted to do didn't work. And it's not your fault. It's not my fault. It just didn't work. Let's modify it. What about, though, if a patient turns around and says, "Oh, look, yeah, I'm not likely to do exercises. So I felt good after the treatment. So I've just come back for another treatment to see if we can top that up, make me feel better. I'm pretty lazy and I don't like doing exercises, or I don't really want to change that thing that's causing the problem. So let's just do a treatment." What would you say to that?
Well, for me personally, they're not my type of client. I'd probably refer them on. But, again, it'd come back to the reason, what are you hoping to get out of this session? What do you think is going to help this long term? Because I would say, I can help you very short term. I mean, I can apply a manual therapy treatment to reduce some symptoms. However, if we're not creating a strategy for improvement over a longer period with some progressive return to life or return to exercise, then these symptoms are likely to be a little bit more persistent. So I'd sort of educate them about the reasons associated there, or what's stopping them from participating in some movement, some exercise, just general daily activities. And see if we can figure something out there. But if it was someone that just was, that's it, no, that's all I want, I just want you to poke and press and rub, I'd probably do it for that session and then refer them on. But that's just me.
Yeah, I think I'm in the same camp with that one, and that it really does require us to draw a line in the sand, doesn't it? Because some practitioners are happy to have that revolving door of the same 20, 30, 40 patients that just come in week after week, and they're the same people that are just there to get that top up or that kind of, flush out, or whatever term they might like to use to kind of make them feel a little bit better. But if our goal is to be a clinician, to be a practitioner of health and move people towards a solution, I think it goes against our obligation, our ethical kind of framework to sort of say, okay, I'll just poke, prod and rub you, like you said, make you feel better today, because if that long-term solution is the goal for us and it's the goal for the patient, it's not the way to get there, and it might be that you have to fire that patient through referral, through just sort of saying, okay, I understand that you didn't get to that. I understand that you're probably not likely to follow my advice or instructions going forward. Fair enough. Fact of the matter is, I'm probably only here to help people who really want to get a long-term solution or an outcome. And this is me personally, and everyone needs to make this own decision. I think you're on the same boat. We're just going to sort of say, well, maybe I'm not the practitioner for you. If you want someone to rub your muscles each week and make you feel a bit better, there's people out there that'll do that. I'm probably not your man. And that makes them stop and think, doesn't it? It really makes them think about the fact that, okay, I can't even pay this person to help me. They won't help me unless I help myself. Therefore, I now need to make a decision. Will I participate or won't I? And sometimes that's just enough to kind of, get them on the straight and narrow. I used to see these patients 5 years ago. I've probably told you this story before, where a lot of them would go to this particular dietitian. I think she was a dietitian, and they used to call her the diet Nazi, right? And they were 1000% compliant with her advice. 3 or 4 patients are all going to see her. 1000% compliant. They never made a mistake because she absolutely terrified them every time she sat down across the table for them, because she just read them the riot act if they didn't do exactly what she said. Now, this is the extreme end, right, of the pendulum swing, but they're using a little bit of that, line in the sand approach, like, this is the way that I know will help you. It's the only way that I can help you. Will you participate? Yes or no? Okay, you will. Now let's find a way that will work for you. So you soften that and you go, let's let's have a shared decision-making process. You go, okay, now we've agreed on this. It's almost like a contract. We've agreed to do this. Now it's up to you, Mr. or Mrs., whatever your name is, to go and do those things. When I see you again, I'd like to see that you've hit most of these targets. Now, if you haven't, we're going to sit down again and talk about it more. If we're going to move forward, there needs to be a plan, not a day-by-day approach.
Yeah, I agree. And I think a good way to frame it from the start is, are you after a quick fix or are you after more of a long-term solution? Because, getting them on board with those longer term changes, we know that the changes that we see with exercise, are typically over a longer period of time.
Yep.
We can't expect to do one exercise and instantly be stronger and bigger or whatever, have more tissue capacity. I mean, that would be nice, but it just doesn't work that way. So like you said, having that contract saying, this is likely to take between 6 to 12 sessions over a period of maybe 12 to 20 weeks, however long. They may not need to see you every week, but understanding that time frame of how long things take, and giving them some like an exercise program that may last for 4 weeks. When we look at training blocks in different phases, a typical training block may go from 4 to 6 weeks, and then that might progress to another 4 to 6 week block, and so on. That's because that's how long it takes for adaptation when we apply progressive overload, and there's that super compensation. So getting someone on board with this over a longer period of time, framing it up to say, well, as far as symptom modification and reduction of pain, we can apply some manual therapy in the short term, and then we'll progressively space that out as your capacity, your strength, and your pain decreases. We'll move you into more of an active rehabilitation plan. Is that something that sounds okay with you, and that might get you back on board with your exercise, your running, whatever it may be? So framing it from the start about how things might look.
Yep.
With a realistic expectation. It's not just going to be, 2 to 3 sessions and I should be better. Because I've made that mistake as well, not really framing that right. And they sort of, after 3 weeks, like, oh, I'm not really any better. It's like, well, yeah, I mean, I can't just magically fix you. I'm not that good. Your body needs to heal, and we've got to go through this process.
Yeah, definitely. And I think for anyone to hit a target or to have a goal, you have to give them something to aim at, right? If they want to hit a target, you have to give them the target to aim at, and understanding tissue pathophysiology. So they've got a ligament sprain, they've got a torn muscle, they've got an inflamed or irritated joint, whatever it might be. Okay, we have to understand, how long does it typically take the body to change from that situation? And then, okay, we tell the patient it's 6 weeks, it's 2 weeks, it's 9 weeks, whatever. Based on our understanding of tissues and how they behave. And then we go, okay, here's what we're going to do in the over that time period. Short term, in the very early beginning, there'll be lots of me doing things for you. There'll be a gradual progression away from that. You need to know that from the start. So it's not like you're going to get 55 minutes of hands-on a day and then the same thing next week and the same thing the week up. It's going to gradually change, and it needs to. Are you okay with that? Because that's how I work, and that's that line in the sand. That's how I work, and they know from the start, and there's no surprises down the track. And I think the other thing we often harp on about, Bo, you and I, which is this idea of hands-on versus hands-off, and this is the beauty of this framing it up with a plan, is that you can say, well, if I was just to give you exercises from the start, which I know you're probably not going to benefit a great deal from on session number 1, you won't feel better straight away. But if I do a little bit more hands-on, you will feel better. That won't last long term. So here's how we're going to play it out. A bit of manual therapy to start with, reduce your pain. It's going to get you on board. Right? That's what I'm thinking. And then session 2, we'll do a bit less of that, and we're going to incorporate some more activity, some more movement. And because you'll then to start feel some ownership and take some control. And then we could gradually progress that over time to less and less of us and more of them. And that's the beauty of being able to sit in more than one camp of the hands-on versus hands-off. It's like, I'm hands-on, and at the right time I'm hands-off, and at the right time I'm just giving advice, and at the right time I'm doing all 3 of those things. It's not not having to decide which one's better than the other. It's being able to dip the toe in each one of those puddles.
Oh, 100%. And that's the thing, what a lot of what we do with exercise, it's not always just about improving tissue capacity. It's about changing someone's beliefs about how they move. It's about changing their behavior and their lifestyle factors. When we look at the multifactorial nature of pain, there's so many different influences, but you get someone start to move, they can start to take a bit more ownership and manage their own symptoms. They start to feel better, they start to sleep better, they start to have better mood, all of these factors. And at the same time, the symptoms start to decrease. So that's when we look at the importance of exercise, not only on the body, but also on the brain and just overall well-being. So just promoting that exercise and movement. And we can complement that so well with manual therapy. We can complement it so well with education. All of this stuff fits together so nicely. And it's not that you just do only one or only the other. They really tie in nicely together. And it's just about getting your patient on board with that.
Yeah, getting compliance.
Yeah.
If only we had a better term for that. I'm sure there's a better word, but that's the one we typically use. So I think that's really good, Bo. That's a great way to frame things up. And I think, I hope at least people listening or watching this at home will have sort of been able to take some bits and pieces out of that. These discussions, I think, are really important to have because we're all guilty of getting this wrong from time to time. I know I certainly am. And I've been that person who says, oh, you didn't do the exercises? Oh, well, because I don't want them to feel bad. Maybe they need to feel bad just for a moment. Maybe they need to recognize that this is important enough to actually, okay, I should have done it. And here's why I still have pain today. Without, making them, with putting a negative light on it, but actually just saying, no, this is important. Holding your ground and framing it up in a way that they can buy into and get some shared decision making, like you said before. So that's really good. All right. Well, let's leave it there today, Bo. That's great. Thanks everyone for watching.
Thank you.